I'm the host of the microbiology show today. And today we have a very special guest. Her name is Chagas disease, and she will be joining us for a very special interview. So everybody, welcome Miss Chagas disease. So to give a little background, Chagas disease is an inflammatory and infectious disease caused by the parasite Trypanosoma cruzi. That parasite is found in the feces of a bug called the triatomine bug. But we would like Chagas to explain further herself on her life and what it's like. So Chagas, where exactly can we find you in the world? So I've actually mapped out where I'm most commonly found, and that is in South America, Mexico, and Central America. That's because these are the primary areas of the triatomine bug, but however, rare cases of me have been found in the southern United States, so watch out. Interesting. So there's a lot of things down in the south that people need to look out for regarding you. Could you tell us a little bit about the history of who you have infected? So right now, an estimated 8 million people are infected worldwide with my disease. Mainly, of course, in Latin America, where I remain to be one of the biggest health problems of the public. There have sadly been more than 10,000 deaths per year. How do you think that you got as far as the Southwest in the United States? Well, that's mainly due to population. So migration, of course, from other countries, but also just people traveling on planes and things like that. And adoption from other countries can also bring over my disease. So, all right, Chagas, could you tell us a little bit about your symptoms just so we know what to look out for in case it spreads over here? Sure. So my symptoms are split into two categories. There's the acute phase, the lesser severe phase, and the chronic phase. So in the acute phase, you can actually be symptom-free, but if any symptoms do occur, they're very mild, and they may include swelling at the infection site, fever, fatigue, rashes, body aches, eyelid swelling, headaches, loss of appetite, nausea, diarrhea, vomiting, swollen glands, and enlargement of the liver or spleen. Okay, and how long does this acute phase last for? So the acute phase lasts for, it can be weeks or months, and they can go away, the symptoms can go away on their own, but if they're left untreated, then it can obviously turn into the chronic phase. So you have to be careful because it can advance without you even knowing about it. Oh no. Can you tell us a little more about the symptoms of the chronic phase? So the chronic phase is tricky. The symptoms could occur 10 or even 20 years after the first initial infection of the disease. The symptoms include irregular heartbeat, congestive heart failure, sudden cardiac arrest, abdominal pain, or constipation due to an enlarged colon. Well, that sounds awful, and all because of a little bug. Could you further explain a little bit about the bug that causes your disease? Sure. So the triatomine bug carries a parasite called Trypanosoma cruzi, but short for T. cruzi, that's what I call it. Triatomine bugs primarily live in mud, thatch, or adobe homes in Central America, South America, or Mexico. They hide in crevices in the walls or roofs during the day, and they come out at night, feeding on sleeping humans. These insects become infected with T. cruzi when they ingest blood from an animal that's already infected with the parasite. These bugs are called kissing bugs because they like to kiss or bite the face of sleeping humans when they're asleep. So after the infected bugs bite you, they defecate after feeding, leaving behind the T. cruzi parasite on the skin, and then the parasite can enter your body through your eyes, mouth, a cut or scratch from the bug's wound, and so on. Wow, that's pretty gross. Could you explain a little more in detail about how the parasite actually gets into the blood? So yeah, I've actually drawn a picture as well of the T. cruzi parasite, which is in the bug. So the T. cruzi parasite is actually a protozoa parasite. You can see here it lives in the mid-gut center of the bug. So I'll show you a picture of what I drew, a little cycle. So this is the bug. This is T. cruzi in the bug. There's the flagella. And then it multiplies through binary fission. And then eventually, after it multiplies for a long time, it turns into this bigger type of cell. And the cell is called a trypamastogote. And it cannot divide, but this cell is able to get into a human cell. So what happens after it gets into the human cell? So I have a picture also for that. So this is the trypanosomogoat from where we saw with this one, how it gets, eventually turns into this. Then it goes into the human cell and it becomes an amastogoat, loses the flagellum. Binary fission happens, so it keeps multiplying over and over, and then it turns into a blood trypanosomogoat where it infects the human body more. Wow, that's actually pretty interesting, but pretty scary at the same time. Okay, Chagas, so we've talked a lot about who you've infected and what it's like to be infected by you, but we haven't yet discussed how people are actually diagnosed with you. Could you please elaborate a little further on that? Yes, so people can be diagnosed by observation of the parasite in the bloodstream by using a blood smear and looking at a microscope. So what they do is they take blood and they smear it on a smear. They stain it so that you can see the parasite under the microscope. Diagnosis is generally made by testing with at least 2 different blood tests to make sure that my disease is really inside. Okay, sounds pretty cool. How would we be treated if we got diagnosed by you? The treatment for me is mainly focused on killing the parasite and managing the symptoms. During the acute phase, there are certain prescriptions that may be of benefit. However, these drugs are not available in the USA. But if someone in the US really needs the medications, then they can get them through the Centers for Disease Control, aka the CDC. And once I progress into the chronic phase, sadly, the medications don't really do their job very well. But it'll slow the progression of the disease. Oh, well, that's sort of a relief, but kind of not a relief at the same time. On that note, I just have one more question, Chagas, and that's how will we prevent you from infecting us? So the best way for you to prevent me from infecting your blood is to avoid sleeping in an adobe house, a mud house, or a thatch house. If you have to sleep there, another way you can prevent my disease is you soak a net in insect repellent and you put the net around your bed so that the insects can't come in and bite you. Other extra things you can do is put insect repellent on your skin at all times, and also use insect repellent just like around your house to make sure the insects stay away. All right, well, thank you so much, Chagas Disease, for joining us today. It's been a real pleasure. Thank you for having me. It was a pleasure. I'll see you next time. And that sums up our show for today. So thanks for watching the Microbiology Show with Bella Monero. Bye.